Hello, I'm Emma Howard and I'm joined by Dr. Jonty Heaversedge, who's an expert on men's health problems. Hello, Jonty.
Hi, Emma.
I've got a simple question here, although I know I'm complicated answer, I'm sure, but put simply, why aren't all men given PSA screening tests? Now, PSA is to do with the prostate, isn't it?
That's right, yeah. PSA stands for prostate-specific antigen. It's actually produced by normal cells in the prostate as well as by cancerous cells in the prostate. And I guess that's why that actually gives you half the answer there. That's why we don't use it for screening in this country at the moment, because it can be raised. If you imagine you do a blood test and it comes back high, it can be raised for conditions that are not cancerous. So it can be raised in conditions such as infection, or even in a benign condition where the prostate enlarges. So that means as a test, it's not accurate enough to use in screening.
So it's not like breast cancer screening, because clearly I think this question has come from a man who's saying if you screen for breast cancer for all women in this country, why can't you do it for men and the prostate?
Absolutely. And the answer is simply that we don't yet know enough about PSA to use it for that. In America, over 50, they are using it. But this is to try and make it a little bit clearer, there are a couple of risks with this. One is that some men have prostate cancer and have a normal PSA. So if you rely on the test, you may reassure people incorrectly that they don't have cancer. The second thing is that a lot of men, probably up to 2/3 of men, may have a raised PSA but no cancer present. So what do we do with those men? If they go on to have other investigations, which in themselves have risks attached to them, then actually we're putting people through unnecessary further testing. So it's just not a clear enough test yet for us to use it. But there are some big trials going on in Europe that may give us a little bit more information about the levels of PSA and how we can be a bit more specific and use it as a more helpful tool than I think we can at the moment.
So clearly it is a screening test that happens in this country only when you're sort of down the road of investigating a prostate problem.
Precisely, yes, that's exactly right. If you get symptoms suggestive of a prostate problem, if you're having difficulty passing urine, if you're having to get up more frequently at night, any symptoms like that, go along and see the doctor. And the doctor will then do two things. He will examine the prostate, which involves a rectal examination, which a lot of men I know avoid, but actually is a very good test for prostate cancer. And he or she will also arrange for you to go and have a PSA test at that point. And in conjunction with symptoms and an examination,
it gives you a better reading.
Yeah.
That was very clear. Thank you very much for that, Jonty. Well, if you have a similar problem, we hope we may have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.